Story.
They say that a good laugh and a long sleep are the best cures in the doctor's book. But how do we sleep? Some snore and some cannot go back to sleep after waking up. Yet some cannot find the value of sleep because they wake up more tired than rested. My name is Dr. Mercy Korir, and on this episode of Health Digest, Beldin Waliaula tells us more about sleeping disorders, how to deal with them, and where to seek assistance.
To some people, snoring sounds like a common thing, but it's actually a sleeping disorder. Do you struggle to fall asleep? Are you unable to go back to sleep after waking up at night? Do you wake up more tired than rested? You might be having a sleeping disorder. Causes of sleeping disorders vary. They could be physical or psychological. At the Sleep Diagnostic and Treatment Center, who are sleep experts, using polysomnography, they monitor your sleep stages and cycles to identify if or when your sleep patterns are disrupted and why.
A diagnostic tool that is used to assess the level of sleep apneas. It's called as polysomnography, and it composes of various settings that we use to come up with a sleep test by the end of it all, which encompasses the heart rate, what we call the ECG, the brain waves, which we call the EEG, the muscle movements, the legs and the chin, which we call EMG, and now maybe the various breathing patterns, the pulse rate, the SpO2. This is the level of oxygen in blood. Yes, together with the abdominal movement, the snoring, all those, it will give us a comprehensive report in the morning.
A CPAP machine is a small gadget that you connect to power. Then it has a hose and a mask to your face. So what it does, you sleep, you put that mask like the one you're wearing now every night, you put it on your face, or you can have a smaller mask that just comes to your nose. Then what the machine does, or what this device does to you, it just gives some little pressure to your throat so that when you breathe in, the throat does not constrict. So it's not a ventilator, it does not breathe for you, it just makes sure that there's some positive pressure in the airway so that when you breathe in, your throat does not collapse. So that's what we call a CPAP machine. And in fact, the world over, whether you're in Africa, you're in the US, you're in Europe, you're in Asia, use of CPAP is the first line or is a gold standard management for sleep apnea. It saves lives. And it makes somebody's quality of life much, much better. But I would want you to imagine you sleeping with that mask and that gadget there for the rest of your life. Now, for my older patients, they love it. They say, I've suffered enough. And in fact, I know my uncle, my brother, or my sister, or my mom, they use this machine, or they use this device, and they are very okay with it. And Daktari, I would like you to prescribe for me one. So I get patients coming to see me, they just want the CPAP, because they've heard stories. Or they traveled, they went maybe somewhere, and they saw other men using those kind of devices. Now, the major problem is with the younger people. Why? You are newly married, and every time you go to bed, you put this mask on your face. It's going to cause a lot of strain in that relationship. So most young people, they do not like those machines or those devices. And of course, there are some people who get claustrophobia. You just put something on them, they feel like they're choky, they're not breathing, and they can't sleep. Then, of course, there are people who just say, I hate this thing, or that noise is driving me nuts, I cannot sleep. So now, those are the kind of people who worry us a lot, because that is the thing that we know can cure sleep apnea and snoring 100%. Now, if that is not possible, then sometimes as ENT surgeons, we evaluate these patients to see whether there's any surgery that can be done to them so that they can stop snoring. Yes, so that involves doing something we call sleep endoscopy, whereby we make somebody sleep, of course, under some medications. And once you sleep, we are able to put some small camera through your nose. And as you breathe and as you snore, we are able to see which part of your anatomy or which part of your throat is collapsing. Why I'm saying that is because what would make patient A to snore or what is collapsing in patient A could be different from what is happening in patient B and patient C. So just by listening, you cannot tell which part of the throat is collapsing. And that is why we do the sleep endoscopy. Camera, see where the problem is, because we know there are different places or there are different sites that would constrict or collapse and make that person to snore. And which are these sites? One, it could be what we call the palate. The palate is that flap between the mouth and the nose. And in Kenya, people call it the kireme. So people say, my kireme is very big, and I think that's why I'm snoring. So palate could be one of them, and it's quite common. And in fact, from the patients that I have evaluated, I think it's one of the commonest or the leading sites of blockage. The other site of blockage could be the tonsils in an adult, whereby as you breathe in, the tonsils, maybe they're big, or the tissues around them, their tone is less, so they keep on coming together and blocking the airway. Then, of course, we spoke about the tongue. Sometimes some people have a very big tongue, or not a big tongue, but the tongue is big relative to the jaw. Therefore, when you sleep, especially when you sleep on your back, it falls backwards and causes blockage.
Peter Mburu is a sleep technologist at the Sleep Diagnostics and Treatment Center. He explains that there are various stages of sleep that one must experience.
Once you begin to sleep, there are various stages of sleep. Basically divided into two major groups. That is the non-rapid eye movement and the rapid eye movement. The non-rapid eye movement is further subdivided into various stages, which we call N1, N2, N3, even N4, depending on the client, because people have various sleeping habits. Basically, what happens in these stages is the level of sleep. For example, you find this first stage means that you're not completely asleep. Now the second stage, you start going deeper into sleep. The third stage, maybe you're completely gone, whereby all the dreaming and such like instances happen. Yes. And there are various muscle movements. Maybe you find there at various stages, maybe the heart rate is up, in some the heart rate is low. Some people have apnea, some have insomnia. Basically what happens in apnea, there's an interruption in your sleeping because of the breathing. When you're sleeping, you're not breathing well. Either it's interrupted, some even stop, some even gossip. But in the cases of insomnia, you find it's not easy for you to sleep. Maybe because of psychological issues, maybe traumatic issues, maybe a lot of factors. So it depends on every individual.
Snoring is one of the sleep disorders that many assume to be normal, which is not. Dr. Samuel Nyaga, an ENT surgeon and a sleep specialist at the Sleep Diagnostics and Treatment Center, says most of his patients think it's normal for a man to snore, a thought that he refutes.
Not all snoring is normal. Sometimes snoring can be a disease, and it is a disease not just to the person snoring, but also to the sleeping partner of that person who is snoring.
Snoring is this loud noise that comes from the throat when someone is sleeping. It is brought by the narrowing of their airway or the pharynx. Snoring becomes a disease when one develops obstructive sleep apnea.
Snoring can be the first or the only presentation of obstructive sleep apnea. Having said that, again, it's important to note that not all patients who snore suffer from obstructive sleep apnea, but all patients with obstructive sleep apnea, they do snore. And therefore, it will be important to screen patients with obstructive sleep apnea from the population of people who snore. It is because of narrowing of the airway, what we call the pharynx or the upper part of the throat. So when somebody is breathing, ideally the airway should not constrict, and therefore you should not be hearing the air passing. Now, if the airway constricts, and there are many reasons that can make that to happen, and I'm going to list some of them, then you have that noise that comes when somebody is sleeping. And the conditions that might make somebody snore, sometimes you could have certain things, or we'd call them anatomical or normal structures in your throat that are bigger than normal. Like in children, the leading cause of snoring would be children having large adenoids and large tonsils. In adults, sometimes it could be because of the tongue big or large, and therefore when somebody sleeps, it blocks the airway. Sometimes we've seen people with certain tumors or cancers in the throat that the first presentation will be snoring because, of course, the airway will be narrowed.
Also, snoring comes with age. Older people tend to snore more compared to those who are younger.
As we become older, the muscle tone in our pharynx or in our throat, the muscle tone reduces. And we all know that the moment you sleep, naturally the muscle tone goes even lower than when you're awake. So as we become older, we sleep, our muscle tone is weak, then the airway just collapses and we start snoring. Now, apart from age, there are other conditions, acquired or environmental, that can reduce the muscle tone. And one of them is obesity. So we tend to see a lot of snoring with sleep apnea in patients who are obese. And like the kind of patients I see, mainly the men, the wife will bring them and say, when I married this guy, he was 68 kilos, he never used to snore. After 5 years, this guy is 90 kilos, no, he's been cooked for, he's been taken good care of, he's added weight. And then she'll tell you when the weight came, that's when he began snoring. And I've noted sometimes when he goes to the gym or when he checks on his diet and the weight goes down, he stops snoring. So obesity is a leading cause of snoring in both men and women.
The use of alcohol is also said to be a contributor to snoring. Alcohol suppresses the muscular tone and makes people snore. Other drugs, like sedatives, also lead to snoring.
Snoring may be or may not be a disease. Now, when does it become a disease? It's now when you develop what we call obstructive sleep apnea. And what is obstructive sleep apnea? Now, if you talk to the sleeping partners or the parents of children who snore, they will tell you this, that this person, they snore continuously, then at one point, they keep quiet, they stop breathing. Now, we talk about apnea if somebody stops breathing for at least 10 seconds. You listen, snoring, 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 then they stop breathing. And the partners or the sleeping partners or the parents have different words of explaining this. Others will say they choke at night or they gasp at night. And in our environment, they will tell us anashtuka usiku. Yes, that is. And in fact, most sleeping partners, especially the wives, will tell you, when this guy stops breathing, I knock him. I just start maybe hitting him on the ribs with my elbow, or I hold his face and turn him so that he can sleep in a better position. Yes. Now, that sleep apnea, you can imagine 10 seconds or more. I've seen people who stop breathing for even close to 1 minute. Now, you'd imagine during that time when you are having this apneic spell, there's no air that is getting into your lungs. So obviously what that does to your oxygen levels, they come down, isn't it? Now, the brain is a very clever organ. The brain will realize that my oxygen levels are coming very low. So the brain knows that the only way to make me breathe better is to lighten my sleep or to wake me up from that sleep. And therefore, these people who get snoring with sleep apnea, they keep on turning and tossing in bed, and then their sleep is very much fragmented, what we call sleep fragmentation, because the brain will wake you up. when it realizes that your throat is completely blocked, or when the brain realizes that your oxygen levels are very low. So you wake up.
Dr. Nyaga says with sleep fragmentation, one will think they have slept the whole night. Yet, in the true sense, they've only slept for few hours. Often, someone will wake up in the morning feeling extremely fatigued.
Because of that, you start getting a lot of headaches during the daytime, and you also develop something very important that we call excessive daytime sleepiness. These are those guys, you have a meeting at 8 in the morning and the guy is already asleep. And I have patients who, some have told me they are people who lead very big corporates, other people are maybe students, and they tell me at 8 o'clock, I can hardly stay awake. In fact, it's important for the listeners to know that excessive daytime sleepiness or chronic fatigue during the daytime may be the symptom and the only symptom of obstructive sleep apnea. And this would come maybe even in children. They go to school and the teacher is always there saying that this baby is always sleeping, this baby is ever tired, this baby does not pay attention. But if that teacher was to talk to the parents, she would tell the parents, please look at the quality of sleep of this person.
Daytime sleepiness that arises from snoring is said to make some people cause accidents when driving. Snoring is also said to be a cause of conflict in relationships where partners end up sleeping in different beds.
You can also imagine the spouse of this person. And it's interesting to note that majority of the patients I see with snoring, they are brought by their spouses. Because you would know that you snore, isn't it? Until somebody tells you. And even if somebody tells you, chances are you're going to downplay that. And you say, no, it can never be that loud. It's not that bad. No, why are you saying these things now? We've been married for 10 years. Why did you not say it, Kitambo? Why are you saying it now? You have your own issues. But that's not the case. Because there are people who snore so loudly, even like the security people outside your house, they hear. They know that you already now, you've gone to sleep from your snoring. Now imagine if you're sharing the same bed with that person, you won't sleep. Now, if you are the spouse of that person who snores, what does that do to you? Now, you are the one who remains awake. So you also start getting the same symptoms of sleep deprivation. That is excessive daytime sleepiness, irritability during the daytime. People talk to you in the office and you snap at them. You also start getting loss of even memory lapses, because you're not sleeping, the brain is not resting. Then what I've seen also happening nowadays, there's something we call like maybe divorce, kinda. People separate and they start sleeping in different bedrooms because you have to go work in the morning and this guy is snoring. So if you sleep there with him, you not get enough sleep. So you end up disappearing and sleeping in a different bedroom. And of course, it causes a lot of marital strain. If now you are that person who lives alone, then the most important thing is excessive daytime sleepiness. Sleeping. No, the time you go, you eat lunch and you feel you need a siesta, or you eat lunch, you go to the office and you sit on your desk with your laptop and you start sleeping, then it could be an indication of a sleep disorder, and it could be an indication of obstructive sleep apnea. Because if you have insomnia, for example, it's obvious that you'll know that you don't sleep well. But now with the snoring, you don't know. So excessive daytime sleepiness. Yes, so even in your office, in your place of where you go, your friends, if you see people who sleep a lot during the daytime, no apparent reason, or low energy levels, or sometimes forgetfulness. There are people who just forget. Like your spouse promises you that on Sunday they'll take you out for a movie. But that Sunday morning, you ask them, they can't remember they promised you, and you think they're joking. But they're forgetting because the brain does not rest.
Obstructive sleep apnea can cause diabetes and high blood pressure, especially for those who are obese.
Sometimes you get young people, no family history of high blood pressure, but they just develop high blood pressure and there's no obvious risk factor. But if you take history and you examine them, you might discover that the risk factor to getting that high blood pressure was snoring and the sleep apnea. Then, of course, apart from the hypertension, we also know that even cardiac arrests, or what we call heart attacks, they're also commoner in people who snore and people with sleep apnea. And how is that? It's also because when people snore at night and you start getting apnea and your oxygen levels start going down, you also produce what we call stress hormones, like a lot of stress hormones like adrenaline and other related hormones. Now, what those hormones do, they give you what we call arrhythmias, irregular heartbeats. Yes, now, when you start getting those kind of irregular heartbeats, and then probably you also have developed high blood pressure, then you're at risk of getting cardiac arrest. So somebody snores, nobody will think it's serious until one night, early morning, you get a cardiac arrest, probably go to ICU or you die. And it was because of the snoring and the sleep apnea.
Depression and mental illness can also be brought about by sleep apnea because of sleep deprivation.
The snoring itself can also cause insomnia, because sometimes when you start blocking at night, you start choking, you start gasping, you get very lengthy apneas, and you wake up, you might also not fall asleep, or you might get anxious. I've gotten patients coming to see me, they tell me, you must do something today, because the way things are right now, I cannot sleep alone. My work involves me working out of town, and I cannot go sleep without my spouse because I'm afraid I will just sleep, snore, block, and then I die. So it is a serious problem. Yeah, and again, studies have showed that the longevity of life, generally, the longevity of life of people who snore and with sleep apnea is less than those who do not snore.
Dr. Nyaga says when one is obese, there's no other alternative but for them to cut their weight through exercise and diet. Lifestyle modifications also reduces snoring.
Do not take alcohol 6 hours before you go to bed. But, I mean, how practical is that? Yet people take alcohol at night after work. Take alcohol, then within an hour or 30 minutes you're in bed. So don't take alcohol at all. Or if you must take, then not more than 6 hours before you go to bed. Again, smoking also causes snoring, so we tell people to stop smoking. Then there are many other things like, when do you take your dinner? Because we do not want you to take your dinner at 9:30, then 5 minutes after that you've gone to bed. We would always ask you, please take your dinner probably 3 hours before you go to bed, so that by the time you're going to bed, the food has emptied from the stomach, and you breathe much more easily when you are that way. Then there are things we tell people. And apart from that, we tell people, when you go to bed, be as comfortable as you can. Don't wear very tight-fitting clothes. Just wear loose clothing and that kind of thing.
Having a regular sleep time is also said to aid in reducing snoring levels, but there is no medication to treat snoring. Sleep apnea diagnosis is done in a sleep laboratory or a sleep clinic. Suspected patients get admitted overnight and their sleep is monitored and the loudness of snoring is measured in decibels.
In the sleep lab is what we call the apnea, or the severity of the apnea, or what we call the apnea index. And again, I will remind you, apnea is that period when you stop breathing for about 10 seconds, for at least 10 seconds. Now, where we are concerned about the sleep apnea, and I'm going to repeat this, is because the sleep apnea makes your oxygen to go down. And now these fluctuations in oxygen level is what is going to give your body, that is your heart, your brain, your liver, your blood vessels problems. Now, in the sleep lab, we're able to know, is your apnea mild? Is it moderate? Is it severe? No, in medicine, we like grading everything, basically into those three categories: mild, moderate, and severe. Then still, in the sleep lab, we monitor your oxygen levels from the time we hook you up to the gadgets to the time you wake up in the morning. Why is it important? You can get two people who snore, their snoring is probably the same, but one, the oxygen levels, they are always okay. But for one, the oxygen levels go very low. So when you're faced with those two patients, again, you know who is more of an urgent case or emergency case and who can wait for some time and do other things and could probably reduce their weight.
Other sleep disorders monitored in the lab are restless leg movement, sleep talking, and teeth grinding through a polysomnography machine. A holistic approach of having a good sleep is having a healthy bedtime routine and having a good sleep hygiene. Built in. Waliaula KTN News.
This is KTN News.